morning, everybody. It is the appointed time. We've just had our second snowstorm of the season here in Toronto. So the commute was a bit messy into the office yesterday, but I look out the window in our boardroom here in Toronto and it's blue skies. So things are looking up. I trust everyone as well. We did have a good number of people respond that they'll be joining us this morning. So I think people will continue to filter in. But as Becca will remind us shortly, this is also being recorded. As we know, time zones and people's schedules, especially this time of year, can be quite challenging. So we expect a good participation after the fact as well, as we post this video to our Slack channel. But without further ado, welcome. This is our 8th webinar. And a topic that we haven't covered yet on early cleft care, and especially around training healthcare professionals. If this is your first time, welcome to the Circle of Cleft Professionals. We are a network of international professionals and NGO people who are really interested in comprehensive cleft care, especially in resource-constrained settings. And our agenda for today, as you can see on the screen, we'll give you a quick update of where we are with the Circle of Cleft Professionals. We're delighted to have Gareth Davies and Kostadinka Bojikova this morning on the call. They have a presentation for us, and then we'll spend some time in questions and discussion, as always, really thriving on this kind of interaction and the way that people are able to think about the issues that are presented and talk about how it might apply to their own contexts. So at this point, we're almost at 150 members in over 25 countries. Most of the disciplines we would associate with comprehensive cleft care are represented in people's primary interest in joining, and that continues to grow, which we're delighted. And again, we have you to thank for that. So thank you everyone for spreading the word. It's lovely to see these pings of people making the connection and completing our short application to join. And in large part, that's because of these international charity supporters. So as you can see, 10 charity supporters so far who've been recommending presenters. And those are around the world. And so it's been a delight so far to come to our 8th and final webinar of 2019 and looking ahead to next year in 2020, which we'll talk about near the end. So today, again, I mentioned early cleft care, training healthcare professionals, and it's a very experienced team. Kostadinka Bojikova and Gareth Davies are going to let us know what they've been learning through this package that they've been using to train healthcare professionals, especially in Eastern Europe, but in other places as well. And that starts from the knowledge and skills required to make an accurate diagnosis, advice about early feeding, this has really been something that's been helpful in changing how health professionals think about cleft and also equipping them to support families well. So Kostadinka Bojikova is a cleft specialist nurse and cleft educator, and her team is centered in Plovdiv, although as I learned this morning, that's not where she lives. Maybe she can let us know a little bit about that later, and has been working with the team since 1997. And Gareth Davies, many of you will know, is the founder and executive director or CEO of European Cleft Organization, ECHO's focus is to provide training for patient groups and health professionals across Europe with a focus on Eastern Europe. Gareth has been involved in many elements of bringing healthcare, comprehensive cleft care standards and best practices to the world through the Committee for European Standardization and also on the World Cleft Coalition. So without further ado, I'll pass the chairing over to Gareth and to Kostadinka to let us know a little bit of what they've learned about early cleft care training healthcare professionals.
Okay, Hugh, thank you very much for the introduction. I think you've covered everything there about both our backgrounds. I hope everything works today. I'm here in France, where I live, and Kostadinka's in Bulgaria, and the rest of the world knows where they are. So I'm going to switch over to share my screen in a moment, which I hope goes smoothly. And then we'll just run straight through. I'm going to now see whether this works. I hope so.
There's a pregnant pause as the community around the world waits.
All right. I'm not sure which is working. Let's see.
There we go.
Okay.
Well
so
done.
This is not about the European Cleft Organization. It's about nursing, but I couldn't resist saying two things. So European Cleft Organization has been around for 11 years. I was a founder member. A European-based NGO. Our focus is on education and training. We focus on standards development and overall multidisciplinary access to good cleft care, and we have a unique user perspective. So that's ECHO, and we are also working a little bit on developing standards beyond Europe, but I won't go into that now. So today we're actually just talking about, I can't move my slide forward. Let's see. For some reason my slide is not moving forward. There we go. All right.
Yeah, we're seeing your screen, Gareth. You're doing great.
Yeah, are you seeing the same slide?
We saw another one for a second, but you've flipped back to the initial one.
So what are you seeing now? Because I'm not.
We see your opening slide so far.
Which is the European Cleft Organization?
Correct. Yeah.
Yeah. And I'm moving forwards and nothing's happening on my screen. Hang on. I wonder if I should come out. How unusual, it worked before. No. Mm-hmm.
So Gareth, we have your slides here as well. So if you're stuck, we could run them from this side if that's
maybe
best
it's
for you.
strange. Let me try one more time because it was you can probably
Sure.
see
Yeah,
me
we definitely, it worked.
Yeah.
It was advancing. Sorry, everyone. We'll bear with us through these technical difficulties. Okay, we're back. We see your opening slide, Gareth.
Yeah, but it's not going backwards or forwards, and I haven't a clue why.
There's a button there. We can see your cursor. There's a little arrow there. If you click it.
There we go. Yep.
Okay. So okay. I was using my screen. I was using the buttons on the keyboard. Okay.
Yeah, that's
all right.
That'll work there.
Okay. So yeah. So sorry about the delay, but early care training program. I think I can now move on. Yeah. There we go. Let me go back. That one. Okay. So is there any way I can remove the pictures over my screen? Let me see. Yeah, I think so. Okay, that's fine now. So what we're going to talk about today is the background to the training, the development of the course, the resources that we have online, which I'll take you through, but that's not live, luckily. It's actually just copies of pictures of the website, so we shouldn't have any technical problems there. We have some guidelines on how the course should be run, and we have then Kostadinka will take us through a summary of the actual training modules themselves. So why did we start on this initiative? Well, we were working in Eastern Europe and we did some survey work with the UNICEF, and we were aware that there was a large problem with babies with clefts being abandoned and ending up in orphanages, simply because there were issues around early diagnosis, early care. They were missing the fact that it was a straightforward cleft. They were using nasogastric tubes unnecessarily, and children were being, parents were being encouraged to abandon their children, and we felt this was really something that shouldn't be happening. So we set about developing some guidelines, and the guidelines basically took us through early cleft care. They were finalized in 2015 by the European Committee for Standardization, and they were widely accepted and approved. But the problem is, how do you actually implement guidelines? So we felt if we have a set of guidelines, the best way to actually encourage people to use them is to teach people how to use them. So rather than just saying use these guidelines, we needed to actually say, well, this is how you actually implement good early cleft care. So we applied for funding to develop a course in early cleft care, and we had project partners from 7 countries, one of which was Bulgaria, where we've done a lot of pilot work. And the idea was to have a course that could be used everywhere, downloadable, a 1 or 2 day course. And we received funding from the European Union Erasmus program. So those are the partner countries on a rather busy map. But you can see we have a mix of countries spanning the whole of Europe, so north, south, east and west, which is always good, which allows us to look at different cultural contexts as well as resource contexts as well. And the aim was to develop a short 1 to 2 day training program for health professionals that will equip participants with the necessary specialist skills to assess the infant, determine whether there are any other associated anomalies, and to formulate a treatment plan which allows the infant to thrive normally. And this was a 2-year project that began in 2017, and we are just about to finish it. We're in the process of completing the website, which is the main training platform for the resource, and we are in the process of finalizing the translations in all the partner languages. We also hope to be able to have this translated into many other languages through further EU support through, there's a body called the European Reference Network for Rare Disorders, which are showing a great interest, which could indeed bring us into a good Spanish translation, which would obviously have knock-on benefits to other parts of the world. So, right, I'm going to take you straight through now to what the resource looks like on the internet. The web address I'll give you at the end, so you don't need to look now. This is not live, this is a screenshot. It's safer that way. But basically we have all the resources are on a web platform on this site. We have across the top about the project, that's the background. We have news, we have the training resources, which are the key part of the site which people will use, and then we list the partners. So if you click on resources, you get to this, and on that page you have a whole list of resources that we've developed. Educational resources, which are a poster about the program, a flyer about the program, pedagogical handbook, and also surveys of populations of health professionals and parents that we use to formulate what would be the best approach to do the research, to actually develop the program, so that we actually had from the parents themselves what the issues were and what they needed support with most. So further down the page, again, this is a report written about the family's perception. So this is all material that was developed to ensure that we had the right knowledge to put the right information into the course. And the family's perception was it was actually 98 families who were interviewed, and they told us all their issues, the positives and negatives, and we used that to develop the course material. And you can see it's already translated into all the languages. If you go further down, you actually get to the core training material, which is, again, in all the languages. You've got Module 1, Module 2, Module 3, and Module 4. And Kostadinka will take us through those briefly after I finish speaking. And those are all in PowerPoint presentations, so there's no issue of people not being able to open or close them. It's a standard PPT platform, so they will all open up in a PowerPoint, and then there'll be maybe 50, 60, 70 slides per PowerPoint, and within those slides you have learning points. I will learn in this section, this module, A, B, C, and then there will be test slides as well to actually see whether the knowledge is being retained. And during the process of developing the course, we piloted it on several populations, and we did pre and after scoring, and in fact 6 months later as well. And the knowledge keeping has been actually very good. So moving on, when you click on the modules, you get, as I said, to a PowerPoint, which we'll come on to later with Kostadinka. I think essentially for this course, and whilst the training material is of very high caliber, we felt it was very important to actually tell people how to run the course, and the sample agendas, programs, and the number of hours per module, that kind of stuff is all very clearly put together in the handbook, which I'm going through here. So the handbook contains didactic guidelines, and the modules you can see on the slide on the left-hand side. So you've got the face-to-face teaching hours, there's self-study hours as well, there's a reading list, which I'll show you in a minute, and then there's time that takes for the pre and post scoring, and so the total hours is on the right-hand side. I think the total course, as we've designed it, comes to 27 hours. That's with self-learning, self-study included. And the 27 hours is not a random figure. It actually tallies with what in Europe is known as a European framework for vocational training, or ECVET. So moving on. We get, again, the level of the training, again, in terms of European framework for vocational training. This is targeted at level 4, which means, as you can read, that the level of knowledge is given as a factual and theoretical knowledge, and the skills, cognitive and practical skills, and also the ability to think outside the box as well. So there's a little bit of creative stuff there. And management of self-management of time and that kind of thing is required. We think it's a pretty comprehensive set of guidelines. We have possible programs which people can adjust with different modules at different times. The lunch in some countries will be rather late, as we've got here. I think in Spain it will be appropriate, but certainly not in the Netherlands, rather late in the day. But it gives you an idea of how we can fit this into a 1 or 2 day program with self-study hours to be undertaken separately. So again, in the handbook, you actually got the objectives and methods and content of each module, which I won't go through now. Kostadinka will give you a brief summary of that. And we have a comprehensive reading list, which is for the self-study. Currently, it is just an English reading list, which is something that we'd like to build on to include knowledge from other countries. But I think it's a good starting point. And as with anything, you know, this course will remain on our website for the next 7 years. It's sustainable, but I think we will need to review from time to time and reevaluate whether it's keeping in line with current trends of teaching and understanding. So I will now hand over to my colleague Kostadinka, who will actually take you through the training program itself. She can't operate the slides, but I can normally, so I will move straight on.
Hello everybody from me. I'm really very pleased to join this group, and today I have the opportunity to introduce you a short overview of the training materials. I have to say that the training materials are aimed to qualified nurses who want to start working with Cleft children, all Cleft team members, also speech and language therapists who are involved in Cleft care, maternity unit staff, pediatricians, obstetricians, and medical students. The training material starts with a short introduction about the cleft, an isolated condition, and also about cleft as a part of syndromic conditions. For example, Pierre-Bell sequence, Stickler syndrome, velocardiofacial syndrome, and over 400 syndromes. These disorders may result in a variety of developmental speech, behavior, feeding, and breathing difficulties. And the lack of support, the lack of knowledge about the treatment, prognosis, and how to support the family may cause very, very difficult emotional problems and abandonment of children. As Gareth said at the beginning, in my country, at about 10 years ago, a very high percentage of children were abandoned. And now, 10 years later, I'm really very pleased to say that nurses and midwives played a huge role for the reducement of the abandonment of cleft children. And Transforming Faces is one of the organizations who helped to change the situation in Bulgaria. Also, European Cleft Organization, Klapa, ALA, and so. Let's see what are the training modules. Gareth, would you change? Yes, we have 4 training modules. Each of them consists few sections, and as Gareth said, after each section there are questions related to the information given above. So the trainees may check and consolidate their knowledge. Also, there is a reference list after each module and for self-studying. The modules are understanding of cleft, early management and care, support and empowerment of the family, and practical training. Let's see, Gareth, would you help me again?
Yep.
Module 1. In this module, there is information about the normal structure of the oral cavity. Also, the differences in the oral cavity between adults and infants and why it is important. The phases of feeding and swallowing and how these major structures work during feeding and swallowing. Also, the trainees may find information about when and how the upper lip and palate form, from which embryological processes, and what are the main reasons for the appearance of cleft. There is information about classification of cleft, the incidence and etiology. Very important part, how clefts may be diagnosed. Oh, we know that examination of the fetal face is not a routine procedure in many countries worldwide. I remember when I started working with cleft children, I saw 2 antenatally diagnosed children for a year. Now the situation is not better, but now we have 8 to 10 antenatally diagnosed children. So here there is information about antenatal diagnosis, the most common methods for diagnosis, what is the optimum time. Also the late diagnosis, which is very important, what are the symptoms of late diagnosed cleft palate and submucous cleft. Why does it matter, and the common mistakes. Here is a lot of information about some syndromic conditions associated with clefts and which are the most common. Also, the importance of the multidisciplinary treatment, what kind of specialists have to be involved in cleft care, and the appropriate time for treatment. Module 2 is the largest and the most difficult one, I think. The focus here is on the normal feeding, just because the knowledge about the normal feeding gives us the possibility to recognize the devices in feeding and what exactly happens when there is a cleft lip or cleft palate. Normal feeding consists information about the development of the early feeding skills in utero and how this process grow and what is the dynamic of this process at different age of the children. Also, swallowing as a process and what exactly happens when we all swallow. Organization of the feeding, the different types of feeding, and how the difference between nutritive and non-nutritive sucking, and how both types of suckings are organized depending on the age of the baby. Also differences between bottle feeding and breastfeeding, how to stimulate lactation, and what are the benefits for the mother and the baby. Some non-cleft factors affecting feeding, for example, associated problems, gestational age, prolonged labor, some drugs taken during pregnancy, or some drugs given during the delivery. Here is very important information about how different types of clefts may affect feeding and how to ensure safety. Using the experience of our colleagues from the UK and our own experience, we introduce a form for feeding assessment. This form has 3 parts: observation of the neonate, non-nutritive and nutritive assessment. I need to say that observation of the neonate is the most important part of our assessment, just because at the time of the assessment, the morbid conditions maybe not be diagnosed yet, or maybe, for example, in Bulgaria, a very common situation is to not be allowed to see the history of disease of the baby when we go and visit and consult the baby at the hospital. The second part is non-nutritive assessment, and the last one, nutritive assessment. We assess the oral reflexes of the babies, like rooting, gag reflex, sucking, what is the tongue movement, strength of suck, if vacuum presence. And the last one, in the last part, we assess sucking pattern over 1 minute. So this is the number of sucking bursts, the number of sucks per burst, if the baby sustains sucking, swallow triggered, if there is rhythm during the swallowing, and also if the baby has good suck, swallow, and breathe coordination. When we make feeding assessment to ensure safety, we observe infants' reaction, and this helps us to choose the safest method for feeding. We use this form from 10 years, and this is our guarantee that we choose really the safest method for feeding. In Bulgaria, 80% of cleft children were fed by nasogastric tube only, and this happened because the doctors insisted that nasogastric tube feeding is the safest method for feeding. But our experience during the years showed that it isn't the safest one. So this form helped us really to choose the safest method for feeding and to ensure safety. Going through the feeding assessment form, we are ready to decide what is the type of feeding, and in this module we introduce different types of feeding of children with cleft lip and palate, of course according to the type of the cleft and also parents' preferences. Module 2 gives information also how to prioritize dairy management. So we need to know more about clinical signs of swallowing difficulties and also these syndromic conditions which are associated with breathing difficulties, the different types of management of breathing difficulties, and what is our experience during the year, how to overcome and alleviate breathing difficulties. The next module is support and empowerment of the family. In this module, we introduce what is bonding, attachment, what is the impact of the diagnosis of cleft on the family, and how healthcare professionals may affect parents' reactions and emotions. Also some cultural and social impact of orofacial clefts, some positive strategies to support the families immediately after birth. And also here you may find some specific country information about the organization of the cleft care in the countries who are partners in this project. The last module is, I think, and the trainees usually say that this is the most interesting one, because here there are 4 case studies of children with isolated clefts and also clefts as a part of conditions. These are real stories from our experience, and each case, the trainees, receive real information about the situation, the type of the cleft, the problems which family meets during the feeding and breathing difficulties. And after each case, they have to answer questions related to the case above, and then they have the opportunity to check their answers with the right one. This module consists also lots of video materials, and especially how to make a feeding assessment and to ensure safety, breastfeeding of children with cleft lip and alveolar ridge, also how to observe the cleft palate, and how to evaluate the severity of breathing difficulties, and so. I think it's everything from me. Very shortly, thank you for your attention, and if you are interested and you want to hear to see what exactly the modules consist, you can follow the link, and hopefully the information will be useful for you too.
So there's the link to the website. It is actually now complete. We finished uploading all the translations at the weekend. So it's a resource to be used. And we will welcome feedback. I think we'll need to put something up on the website for feedback through the European Cleft Organization. But it's been a really useful 2 years, bringing together 7 different countries with different experiences. But I think it's made the project stronger because we have a mix of resource issues where things are really not available, but still we are able to provide care in a very positive and constructive way. So we'd be grateful for any questions or comments or remarks. I'm not sure how we are with time. I haven't got a clock in front of me, but we can, if we have too much time, we can talk a little bit more about the content of the course. But at the moment, I'll leave it for there and hand back to Hugh, and I'll stop sharing my screen if everyone's noted down the web address there.
Thanks, Gareth, and thanks, Kostadinka. And yes, we'll send through that that link on the Slack profile as well. Fantastic. Yeah, thank you very much for both of you. That's an exciting resource that you've pioneered, and it's great to know that you've brought it now to completion. So again, as usual, please feel free either to just signal that you'd like to ask a question, and you can turn on your video to do so. If that's not easy for you, then you can type your question in the chat feature, and we'll read it out and ask our 2 presenters to comment upon. Yeah, we do have lots of time, so this is an opportunity to discuss more around this idea of early cleft care and how we train and equip healthcare professionals to provide accurate information and better support to babies affected by cleft. So I'll get us started. What motivates a cleft professional in your context to be interested in taking this course? So who are you drawing from, and how do nurses, etc., sign up? What motivates them to learn more about cleft?
I'll sort of answer your question in a sort of backwards way. I think where resources are limited and where there is not the capacity to actually have a specialist nurse in place, I think this course is essential for all other team members. So that would be from the surgeon to the orthodontist and speech therapist, if there is one, because I think it does have the elements of care which is often lacking, and you saw in Bulgaria it can lead to abandonment. So in terms of who it's aimed at and what the motivation is, I think anyone who's involved with cleft care ought to have a walk through this course. And we talk a lot in the European Cleft Organization about skills sharing and skills transfer. Where you haven't got a specialist on the team, well, maybe you can skill up some of the other members of the team to take on some of that role, because the needs of the patients are the same everywhere.
Thanks, Gareth. Kostadinka, what has been your experience in Bulgaria? I know a little bit that there has been a significant shift in attitudes and awareness of cleft in Bulgaria. How have you found the transition in having more cleft professionals or more medical teams be interested in providing better care to children affected by cleft?
Yes, I think that the materials and the knowledge is essential, especially for my country, just because, as I said at the beginning, very high percentage were abandoned, and my colleagues were very interested. Now we have Cleft Specialist Nurse Network from 2013, and we reduced the number of children who were abandoned. We had a lot of cases with prevention of the abandonment, and also a lot of cases of children who are reunited with their families. So I think the course is very valuable, the knowledge is very valuable.
Yes, I mean, the work that we were doing prior to this course in Bulgaria, we were learning what the issues were and how to address them, and that all played into the course development. But having worked with nurses from the UK and other countries, in fact, in Bulgaria, the numbers of those children being advised to be abandoned dropped from 40% to 26% in 5 years. Now, 26% is still too high, but I think the effects of not providing early care can be hugely severe.
Yeah.
Thank you. Yeah, and for me, obviously, it was shocking just to hear the high rate of children being abandoned or left to state care as a result of a cleft, and even being counseled by a medical professional that this would be the best course of action. And obviously, it's been a very inspiring result for ECHO and for the team at ALA in Bulgaria to see that change so significantly in such a short time. We do have a question from Julio in southern Argentina. So obviously this is a program for cleft professionals, but our families, do you have any interest from families, or do you have any sense of how this could be applied for families who are interested in learning more about the medical side of cleft care?
Well, we do have training programs for families, and we actually have a scheme called Contact Parents, where we empower families who have had a child with a cleft to actually support other families. And within those modules, within that training program, there is a lot of information about early care and feeding, because I think it is important, and I think that there are certain elements of this course that could actually go straight up onto a website aimed at parents, because I think it's all valid knowledge. You tend to want to be a little bit cautious with some of the issues soon after diagnosis because of possible problems around sucking and swallowing. So I think we would always urge that where there is an expert available, they should be the one who actually makes the initial diagnosis and actually helps to establish feeding. But the general day-to-day feeding issues and the support for family, support around psychosocial needs, I think this course can offer a lot, and we could well extract some of this course to make it family friendly, as it were. But at the current point in time, what we have on there is designed for health professionals, but we can draw from that for something for the parents and build on what we already have for the Contact Parent scheme.
Thank you, Gareth. I think there's a follow-up from Dr. Julio. Also, is what are your thoughts on how it could be applied? This training could be applied in a place like Argentina.
I think relatively straightforward. It's downloadable from the website. So if you have, what I would suggest is to find someone who is familiar with cleft feeding to use that person to train potential new trainers. So I could see it being a snowball effect where someone who is being involved with perhaps writing this course or is very familiar with the issues can maybe visit and run a test course with colleagues in Argentina, and then those colleagues will then be trained with this material to actually take it wherever it needs to be taken. We've had similar questions from India, in fact, and I think it's getting the ball rolling. It's making sure that in a sense, the first course is delivered in the way that we envisage, but it is not meant to be a closed resource. It's an open resource. So once we've actually gone through the delivery of a new context course, then I think it can be rolled out locally and used by appropriate people in the environment.
Thanks, Gareth. And Dr. Julio says that his questions were answered. It sounds like the start of an interesting process, and a lot of hunger, obviously, in many contexts in which people on this network work, to have accurate information, to have good training resources, to be able to change people's perceptions. Kostadinka, I was very interested in your comment that 80% of babies in Bulgaria are fed through a nasogastric tube. And that's really because of doctors insisting that this is the best way, even though in your experience and according to the literature, this is not the safest approach. Could you comment more about what's that process like of coming up against surgeons having a particular mindset or understanding, and how does a course like this contribute to that discussion of maybe changing people's perceptions on what is good practice?
I'm sorry, I didn't hear you quite well. Would you?
The question, I think, Kostadinka, was about best practice and what are the issues with nasogastric tubes. What are the difficulties apart from the inevitability of the baby not being able to go home? But why is a nasogastric tube not a good idea?
Yes, of course, there are cases where nasogastric tube is an obligatory method for feeding, but 80% is quite a lot. And usually doctors insisted to use nasogastric tube because I have to say that nasogastric tube feeding until the repair. Can you imagine that for children with cleft lip is 3 months and for children with cleft palate 10 months? And this is the period which the family have to manage with nasogastric tube feeding, and usually they think that the baby should be in an orphanage because nurses will look after these children when they are in an orphanage, and the family will not be able to do this. It was something like dogma, I'm not sure. We still have lots of difficulties trying to persuade the doctors that this is not the safest method because, there is a huge gap between nurses and doctors. We still have lots of, we still have difficult communication. But I think that nurses in Bulgaria, especially trained nurses, trained feeding nurses, we are really very well supported by Professor Anastasov. And very often when we have to visit a child in a hospital, usually we need him to call and to say, a trained nurse will come and will give an advice. I don't know why the doctors insisted nasogastric tube feeding, but I saw quite a lot of children who are fed with nasogastric tube with more than 2 aspirations.
And then aspiration is a choking episode, for those who don't know.
Aspiration is the milk in the lung, because an inappropriate feeding. How to say, I'm not sure if I explained everything in a right way. But
no, it's very clear. Thank you, Kostadinka. Fascinating, the connection then between, a misperception of the best treatment and then this other issue that you're struggling with, which is parents feeling overwhelmed, not being able to care for their child at home, not being able to go home, and then even this other incentive towards having the government take care of care, being that this nasogastric tube is too difficult for a family to deal with at home. A fascinating intersection there. You also mentioned the advocacy of the cleft leader in Plovdiv, Dr. Anastasov, and him being able to speak as a surgeon to other doctors or surgeons and having that be an influential voice.
Yes.
I guess I'm open to the whole webinar participants, but also back to you. I mean, how important is that, having someone with the authority of a surgeon or a doctor being the one to meet? You mentioned that distance that sometimes exists between nurses who are on the ground and then the doctors who are maybe making some more decisions or having more weight in their advice. What's that process been like?
Yes, it is very, how to say, it is very important to have someone behind you, especially someone like Associate Professor Anastasov. You know, when the obstetrician or the pediatrician say that the baby should be fed by a nasogastric tube, and then a nurse come and say, no, this baby do not need nasogastric tube feeding, the mothers and the family believes to the doctors. And in this way, I had quite a lot of cases when I just went and visited and saw the baby in a hospital, but the family stayed blind and didn't want to hear what I'm saying. And very common situation was, of course, in the past, not now, but very common situation was Associate Professor Anastasov to come with me and to say to the family, look at this nurse, she know what she has to do, so please hear what she wants to tell you and give her a chance to do something and to help you, to support you. And then the family, how to say, started to trust you, and it is very, very long and difficult process.
So I think over the years there have been a lot of efforts in Bulgaria to make it more likely that nurses will be accepted by local doctors and local hospitals. If I'm mistaken, correct me, Kostadinka, but I believe that these nurses will have a badge which has the name of the hospital in Plovdiv, the main centre, and also they have an endorsement from the National Association of Nurses, or a body similar to that. So they actually come with the credibility on a badge in front of them. So I think building that relationship between the authorities of specialist nursing care in the country as a whole, national authorities, and the individual nurses does actually help empower and ensure that the messages get through that this is actually someone who's really being trained to know what they're talking about.
Also, the parents have the opportunity to share between them their experience and to say, I met a nurse who helped me, I met a midwife who helped me. So they have very good communication between them, and it helps quite a lot.
Fantastic, thank you.
Are there any other questions out there from other participants, or?
Yeah, thank you, Gareth.
Okay.
I was interested, as we wait for any other questions, I was interested that you include an element on family support for these nurses. And then Kostadinka, you just mentioned that connection between family and nurses. How is that element of the training received, and what role do nurses in your context play in terms of equipping parents to go beyond their hospital stay and move to this long journey towards rehabilitation for their children?
Gareth, would you help me?
Yeah, sure.
I'm sorry about my language.
No, that's fine. No, I think it's key that there is someone in the lives of the new parents who is actually able to listen to the wider context of issues, and this might be very much along the psychosocial angles, and it's very often different family members can be very confused as to what's going on, and the core family, as it were, isn't quite aware of what to tell people in their own family. There's colleagues at work, there's extended family, there's going shopping with a baby that looks different, and these can be very, very difficult times for a new parent. And I think that the training in this course will actually equip a nurse to be able to understand what those issues are and look out for sort of early signs of burnout, really, because I think obviously around it's always difficult if you have a new baby. It's hard, you don't sleep much, there's not much time to to look after yourself. And if there is a child with something extra in terms of needs, then it can be very hard. And I think that the whole environment, in one of my slideshows, I have a picture where the family's in the middle and they're surrounded by all these areas of support, but they're actually different areas of support which are all crucial. So on the one hand, you've got the psychosocial nursing type support. On the other hand, you've got the clinical medical team who does the actual reconstruction work. And then you've got support groups, and then you've got friends and family. So you have the family right in the middle, which is in need of a lot of support in all areas. And I think the nurse expertise in looking out for where are the gaps in the overall pattern, where are the gaps in the overall support needs. I think that's really important. And it's not about mechanics, it's often about how people perceive their own needs and whether they are able to talk to others about the challenges they're facing.
Thank you, Gareth. I can see through your presentation that you've put quite a bit of energy into uploading a lot of resources that people in their own context could apply. You know, even to a sample agenda, how they could set it up. What's your hope around that, and how are you? Are there any limitations around this curriculum in terms of someone going on, downloading this and starting to put on their own professional development course if they see a need for having their health teams be more equipped to treat cleft?
Yeah, well, first of all, it's open access, it's free, it's a resource that's there to be used, and we would want it to be used. And I think it does need and will need some adaptations for different contexts. I wouldn't want anyone to actually change what's already there, but I think it could be there could be different elements brought in. There could be perhaps there could be elements brought in that might be more appropriate in a university medical school. So you could actually perhaps draw a short university program out of it, that kind of thing. So I think it is there. It's just to be adaptive. We have suggested ways of it being used. The reason for it being a 1 to 2 day course is we know that people don't have much time. So people can take maybe a Saturday or a Sunday to do a course, but they wouldn't be able to take a whole week off. So a lot of the learning can be done self-study as well, going through material at home. There's a list of references, and the course material obviously can be read at home as well. But we would want someone to actually take the students through it and actually challenge them during the course to see what they're learning, what they're taking on board. So I think it does need for face-to-face time, certainly. So it's not all distance learning or online learning. There needs to be someone actually doing asking the challenging questions and doing the case histories. But I think the course, there's a lot that can be drawn out of it for a wider educational tool.
I also would like to say that when we did pilot testing of the materials, even if we organized it at the Cleft team in Plovdiv and the participants were mainly Cleft specialist nurses, it was very, very challenging and interesting for them because they knew quite new things and very interesting about feeding and what they have to observe and how to look after children, even if they are a member of the Cleft team in Plovdiv. So I think, I think that the materials are very, very valuable, and we need to disseminate them.
Yeah, I just to throw in there as well, the pre and post test scoring during the pilots, one would expect them to be much better after the pilot, and indeed they were. But the surprising thing was that even after 6 months, the level of knowledge was in fact higher after 6 months than it was immediately post test. That's because people have been practicing what they learn on a day-to-day basis in in the hospitals and out in the field. So, you know, we had made them think after doing the course, and they applied that knowledge, and their scores 6 months later were actually higher than post-test.
Wonderful. And again, I think that is an important feature of this training program to draw your attention to. It was part of your presentation, but that this has been subject to some research to see what has been the impact. How are these cleft professionals better equipped to do their jobs, or to contribute to the care of babies with cleft after this workshop? And it's lovely that that's part of your presentation, and obviously gives credence to what you're saying in terms of its impact. And I think, you know, around the world, all of us on this call have been, you know, really moved, I think, by people, those nurses, those cleft teams who are really motivated to see better care, who care so much about these families and the support that they're offered, and ensuring that these kids get off to a really great start in life, and continue that journey towards being fully included in full rehabilitation, full membership in society. And that starts off, obviously, from the very beginning. As Kostadinka was talking about, from the moment of the diagnosis or whenever it happens, that there is that care pathway, and obviously this early cleft care training has had great results in Bulgaria and beyond. So I do want to say thank you to Gareth and to Kostadinka for really leading us through this process, and just doing such a great job of pointing us to this resource. It's already there, it's online, it's available. And obviously Gareth was pointing us to some future translation work that could make it even more applicable to places in South America, etc., where that would be of use. So a quick plug saying we will be posting, as Becca mentioned, the recording of this video. We had some people who were not able to make it this morning at this time of year, so our hope is that we'll continue to follow along via Slack, and that will be posted likely later today. And obviously, if there are any comments or questions, you can find a webinar from Brian Summerlad, Debbie Sells there, as well as our last webinar from Kate Crawley and Pam Sheeran. We've had some good connections based on that, and this one will continue in that line. The next webinar that we're looking forward to is, again, focused on speech and hearing, and this time in South India. And so we'll have Professor Rupa, as well as Dr. Suraj, join us and really walk through their experience of especially doing remote care. So for families in remote places far from Chennai, how do you offer them excellent care towards leading their children to full rehabilitation? So that's January 9th, 2019 at 8 o'clock in the morning here in Toronto, but at various times throughout the day, depending on where you are, and we'll be delighted to join you then. Thanks, everybody. Have a great rest of your day.
Okay, thank you.
Okay,
thank you.
Thank you. Bye.
Bye-bye. Bye-bye.